So let's go over acupuncture point bladder 46. Now, what I'll get you to do is take a look at this model of the spine. And if we look at the neck region up here, we'll see C1, 2, 3, 4, 5, 6, 7. Then we start getting into the thoracic vertebrae. T1, 2, 3, 4, 5, 6, and 7. Now, right at the bottom of the spinous process, inferior angle of T7 is where bladder 46 is, but it's over from that. Let's go to Mickey here so I can show you exactly where it is. So this little red mark that I put on here, which makes Mickey very happy, you'll find bladder 46 3 chun over. So 1 chun in Chinese medicine, the width of the thumb. We're talking about 1.5 chun, which is these fingers. We start getting into 3 chun, so all 4 fingers. Take it over. Now, theoretically, we should be able to use Mickey's hand, so we're going to go in slightly from that point to here. So this would be around the inferior border of the scapula, which is T7. So Mickey, I'm going to get you to raise your arm up there a little bit. Inferior border here, yeah, right over from that point, and 3 chun over from there, about right there. Bring your arm down. Good, excellent. Is that tender about there? Like quite tender.
Yep.
Okay. So this point, bladder 46, is used in musculoskeletal conditions to alleviate pain and tension in the upper back and just the general thoracic region. Pretty tender there?
Yep.
So we could take this and we could move it either counterclockwise, clockwise, get in and roll the area. Now, a question for you, Mickey. When I go here and I go over here, which is more tender?
The left.
Left quite a bit?
Yeah.
Okay. Let's get on that. So we're using it strictly from a musculoskeletal perspective. But in traditional Chinese medicine, bladder 46 is also used to help with respiratory issues such as coughing, asthma, and chest congestion. Now it's kind of interesting though too, because if we were actually using acupuncture points, caution should be used, or we should even avoid this area in individuals with acute or severe respiratory conditions. Because if you're stimulating this point, it could actually make symptoms worse or exacerbate them. Doing okay there?
Mm-hmm.
So if we get in and we work the area out, we'll be working this area out for 30 seconds to 3 minutes. This is bladder 46.